Hi everybody, this lecture is on endoscopes and their application to the body or in the body. We have different types of endoscopes. We have flexible, we have rigid, we have semi-rigid endoscopes. And they are specialized for the part of the body they will be viewing. So it's important not only that you know that different types of endoscopes exist, but you're also going to need to know where they are supposed to be used and in what part of the body. Once you learn what part of the body these endoscopes are going to be used, it makes learning the information a little bit easier because you understand the application and where it's going to be used. Therefore, you need to have a flexible endoscope used in this portion of the body, whereas with this portion of the body, a flexible endoscope wouldn't work. So now we need to use a different type, like a rigid endoscope. So this lecture talks about different types of endoscopic procedures and the endoscopes that are used, as well as why they may need to be used in general. What's going on in the body that's causing some sort of infection or disruption to where we need to take a look and see what's going on. So that is what this lecture is on. Again, it is critical that you know what type of procedures flexible endoscopes are used for, semi-rigid and rigid endoscopes. All right, so an overview of endoscope types. Endoscopes are specialized for different parts of the body. On the left side of the screen, you have examples of rigid types of endoscopes, and on the right is a flexible endoscope. The rigid endoscope on the left will be used in arthroscopic procedures where an incision will have to be made, and then that device will be placed within that incision. Whereas on the right side of the screen is a flexible endoscope, and it is actually only going to be used within the GI tract. So we have flexible on the right and rigid on the left. So the first type of endoscope we are going to be talking about is a flexible endoscope. It is for a upper GI tract or upper gastrointestinal tract. This one in particular is called an EGD. It is for visualization of your esophagus, which is esopho. Gastro refers to the stomach, and duodeno refers to the first portion of the small intestine. So this endoscope is going to visualize all of those structures, the esophagus as it passes through the esophagus down to the stomach and into the first portion of the small intestine, which is the duodenum or the duodenum. It is flexible because it has to be. It has to go through all of those structures, so we need a really bendy tube-like structure to be able to follow that tract and visualize as it goes down. Some indications for treatment are ulcers, bleeding ulcers in the stomach or within the esophagus or that upper portion of your small intestine. If there are any tumors that they see along the way, or maybe they found that on an MRI or CAT scan, this would be an indication of why this type of procedure would occur. GERD is referring to a reflux, gastric reflux disease. So think of the most intense heartburn you've ever had. So this procedure is for upper GI, which GI is referring to your gastro, which is your stomach in med term. Intestinal are our intestines. So this one in particular looks at the three structures, your esophagus, stomach, and duodenum. Next up, we have the lower gastrointestinal tract, so the complete opposite end of where we were just talking about. This is the colonoscope. So this is used for examining the colon, which is the lower portion of the large intestine. It is flexible. It is a flexible endoscope, but it is longer than your EGD scope, and that is because it has more ground it needs to cover. So again, think of in terms of the flexible endoscope needs to be able to make all of those turns and curves with our GI tract, so we need to have a flexible endoscope. If we used a rigid endoscope, it simply would not work. It would just end at one point. So some indications for this procedure are inflammatory bowel disease, polyps. This is also for your colon cancer screenings. So after you reach a certain age, it is a preventative procedure used to screen for early cancers, polyps, and if you have family history, you should be getting a colonoscopy um, earlier than the designated age. Okay, next up we have the bronchoscopy. Now we're looking at the respiratory tract. It is called a bronchoscope. It is used to examine the lungs and air passages. It's available in two forms, rigid and flexible. Typically, if the patient is asleep and having another procedure done, it will be a rigid type of endoscope, but for the most part, it's going to be flexible to allow easy visualization if the patient is just mildly sedated. So it's a flexible endoscope. It goes right down the back of our mouths, down our throat, our larynx, our trachea, all the way down into our lungs. So if you have a chronic cough, you have a lung infection, biopsies, this would be the procedure that would be done. All right, next up is the urinary tract endoscope. This is called a cystoscope. Cysto in medical terminology means bladder. In this particular instance, it means urinary bladder. So for a cystoscope procedure, they will be examining the bladder and the urethra. It is a flexible or a rigid type of endoscope that is used. If there is a bladder infection or tumors, this would be the type of procedure that would be done. All right, now we have the hysteroscope. So we are going to be viewing the inside of the uterus. This is typically a semi-rigid or can also be a rigid type of endoscope. We need some structure, but it's not going up a long tubular tunnel. So we could have a little bit of structure to it in the semi-rigid endoscope. So if there's been abnormal bleeding, fibroids, polyps, they can't figure out what's going on, they will perform a hysteroscope so they can view the area and see if they can spot the source of the problem. Right, we've got the joint endoscopes. So these are called arthroscopes. Arthro in med term means joint. It is going to be examining the joints. So anywhere two bones meet, that middle portion is called a joint. So it could be in the knee, the shoulder, the hip, ankle, wrist. So if there's any type of continual problems with maybe some arthritis or joint pain, there's an injury, they can use a rigid scope. They have to make an incision, put the rigid scope through the incision, and then visualize the area to see if they can clean it up or figure out the source of the problem. Now, keep in mind, rigid endoscopes, because they do cross into the bloodstream, they are sterilized. They have to be sterile in order to be used, whereas the flexible endoscopes that we've talked about so far just have to be high-level disinfected. So keep that in mind as you're studying as well. Okay, and last but not least is your ear, nose, and throat endoscope. So the first one is your nasopharyngoscope and your laryngoscope. So the first one looks through your nose, down the back of it to your pharynx, which is the upper portion of the back of your throat. Laryngoscope actually goes down the back of your mouth to your larynx. Now typically they are flexible endoscopes. They go right up through the nose or even through the mouth and just visualize the entire way down. So if there's a voice problem, throat pain, breathing difficulties, they need to visualize the area. They can use a smaller flexible endoscope to view these areas.